So today's topic is vascular events in inflammation. For that, first of all, we have to know what inflammation is. So, the definition of inflammation. Inflammation is defined as local response of living mammalian tissue to injury from any agent. And what are the causes of inflammation? That is infective agents, bacteria, viruses, fungi, parasites, maybe due to immunological agents, physical agents, heat, cold, radiation, etc., and chemical agents, organic and inorganic substances. Also, inert materials like foreign bodies. And we have to know the types of inflammations. There are mainly two types of inflammation: acute inflammation and chronic inflammation. Acute inflammation, it is of short duration, that is less than 2 weeks. It is an early body reaction and it resolves quickly, followed by healing. There will be accumulation of fluid and plasma at the affected site. There will be intravascular activation of platelets. Polymorphonuclear neutrophils are the first inflammatory cells seen. Chronic inflammation, longer duration and occurs after a delay, and it involves lymphocytes, plasma cells, macrophages, and granulation tissue formation as well as granulomatous inflammation. So, acute inflammatory response involves two major events. That is, the first one is vascular events, the second one is cellular events. Today we will deal with vascular events in acute inflammatory response, which means it is an alteration in the microvasculature. That is, microvasculature includes arterioles, capillaries and venules. And this includes two types of changes, that is, one, hemodynamic changes, and two, changes in the vascular permeability. Now, dealing with the hemodynamic changes, these are the headings. That is, 1, transient vasoconstriction, 2, persistent progressive vasodilatation, 3, elevated hydrostatic pressure, 4, slowing and stasis of microcirculation, 5, leukocyte margination and emigration. Let us deal all of these. 1, transient vasoconstriction, which includes immediate response to injury, and it involves arterioles and lasts for 3 to 5 seconds. Then comes persistent progressive vasodilatation, which involves the arterioles mainly, venules and capillaries, and occurs within half an hour and is responsible for redness and warmth. Third one is elevated local hydrostatic pressure, which results in transudation of fluid and swelling. And the fourth is slowing or stasis of microcirculation, which results in increased concentration of RBCs, again which produces increased blood viscosity. And the fifth one is leukocyte migration. Leukocytes get oriented along the vascular endothelium. They stick to the vascular endothelium and move to the extravascular space. That is what is called emigration. Now we will deal with altered vascular permeability, the pathogens of altered vascular permeability. At the initial stage of inflammation, edema occurs due to vasodilatation and increased hydrostatic pressure, and this type of edema is called a transudate. Later, edema occurs by increased vascular permeability of the microcirculation, and this type of edema, that is called exudate. Appearance of inflammatory edema due to increased vascular permeability is explained by Starling's hypothesis, which includes endothelial lining of the microvasculature first becomes leaky, and as a result intravascular colloid osmotic pressure decreases and that of the interstitial fluid increases, which results in increased outflow of fluid into the interstitial space, right? And what are the patterns of increased vascular permeability? 1. Contraction of endothelial cells. Endothelial cells, they form a temporary gap in between by contraction under the influence of chemical mediators. It occurs mainly in venules, that is contraction of the endothelial cells. Now the second one is contraction or mild endothelial damage, that is structural reorganization of cytoskeleton of the endothelial cells. It occurs in venules and capillaries under the influence of cytokines. Third is direct injury to endothelial cells. This causes necrosis of endothelial cells, forming gaps at the sites of detached cells. This affects venules, capillaries, and arterioles. The fourth is leukocyte-mediated endothelial injury. Proteolytic enzymes and reactive oxygen species released by activated leukocytes cause endothelial damage. This occurs mainly in venules and capillaries. Next is there occurs a leakiness of the neovascularization, that is the newly formed blood vessels. So we have to understand the differences between a transudate and an exudate. In the case of transudate, this is a filtrate of blood plasma without change in endothelial permeability. This is edema of inflamed tissue associated with increased vascular permeability. This is a non-inflammatory edema. This is an exudate is an inflammatory edema. Transudate has low protein content and hence does not coagulate. In exudate, the protein content is high, which readily coagulates. Glucose content is same as plasma in a transudate. Glucose content is low in an exudate. Specific gravity is low in a transudate and specific gravity is high in an exudate. And in a transudate, the effusion LDH versus serum LDH, that is lactate dehydrogenase enzyme, will be less than 0.6. In exudate, it will be more than 0.6. The pH is more than 7.3 in a transudate. pH will be less than 7.3 in an exudate. And transudate contains only few cells, that's mesothelial cells and some cell debris. There are many cells in an exudate, which includes inflammatory cells and parenchymal cells. So, and the last one, that is transudate. An example of transudate is edema in congestive cardiac failure. And an example for exudate is purulent exudate, like pus in inflammatory reactions. Okay. And now we will deal with the 5 cardinal signs of inflammation also. That is, the first one is a rubor, that is, which means a redness which occurs when an inflammation happens. Second is tumor, that is swelling. And third is scalar, that is heat, rise in temperature. Dolor is pain, which occurs, which accompanies inflammation. And the third is loss of function, which is also known as functiolasa. So these are the signs of inflammation. So we have learned the definition and causes of inflammation, the types of inflammation, the signs of inflammation, and also the vascular events in inflammation.